People think that wellness is expensive. They should try illness. It should be the most important thing. And there are other societies that should be valuing this. And I do think it's a crisis in our youth that we're seeing this unhealthiness. And I do think it's hormonal and it's environmental.
It's so interesting, right? We're in 2025 and this is still an issue of gaslighting women, of not giving them the tools and the education. And it's like, at what point in the thousands of years we have been alive are women finally going to be able to be seen and heard and understood? HRT is something a lot of women just don't understand. Like, you hear it, you know about it, but you really don't get it. Could you kind of break down, like, what is hormone replacement therapy? Who's a good candidate? And how does it work?
Yeah, so hormone replacement therapy is different. We kind of mentioned the birth control in that we're enriching your levels. A lot of people will do a lot of things. They'll eliminate all the stuff from their environment. They're doing all your recommendations that you guys recommend, and then they're still struggling. And one way to prevent this estrogen dominance, or to prevent these nasty chemicals and all these problems from binding to these receptors, for example, is...
So we have everybody's favorite topic today. I think most women in our community and our clients, they love talking about hormones. And as women, this is something that we're going to be talking about for our entire life, because we go through so many different shifts that men don't have to go through. Think about, we have our teenage years when you first get your menstrual cycle, and then you come into your 20s, and it's your hormones are constantly shifting and going through different phases of life, whether the childbearing years, having children, not having children, perimenopause, menopause. There's so much happening. So we thought today we would bring in one of the best hormone experts we could find around. That's Dr. Sarah Daccarett, leading hormone specialist and anti-aging expert. We love both of those things, hormones and anti-aging. She's dedicated to empowering women to take control of their health and their well-being. And as the founder of Inner Balance, Dr. Sarah has created a revolutionary solution for women seeking a convenient, effective, and personalized way to manage their hormones. And I love that your mission is to absolutely break the silence surrounding hormonal issues and provide women the knowledge and the tools that they need to thrive, because this is basically the exact same thing we do, but with skin, is giving women the space to talk about their hormones, but also the knowledge and tools that they need, like you said, because so many women, Dr. Sarah, are dismissed to this day when they go in to see their doctor.
Yeah, no, it's devastating. First, thank you for having me. I'm a huge fan. So yeah, it's devastating, actually, the way that we treat women, and such an archaic and so far behind we are in research and development and innovation for women in women's health.
Yeah, because Chris, the one thing that we hear time and time again is, and so unfortunate, they're like, I went to my doctor about my acne, about my moods, about my energy, about my anxiety. And they said, oh, it's just part of being a woman. It's part of being a mom. It's part of getting older. Here's the birth control pill. See you later.
That is again, horrible. This is birth control should be for birth control, but doctors will hand it out like it's candy, or for any kind of women's issue. Oh, you have heavy bleeding, or you have acne, or you're a 15-year-old who want to regulate your period. Here's the pill. And this is pretty devastating, because I don't think a lot of women understand how the pill even works, or hormonal birth control. It's actually not hormones. What they are synthetic fake hormones that bind to receptors and stop the production of your own hormones. So that's how they make you infertile, is they lower your estrogen and progesterone to nothing. And so, women, we're meant to have fluctuations. And so it stops these. And so in a way, you're treating some of the symptoms. But what I find that most women have, 90% of women don't like birth control. They have side effects. They get bloated, they gain weight, they get headaches, they get depression, suicidal, and they get acne, which is weird because they're giving it for the acne. But I think in general, most of the time it causes acne. And that's because you're eliminating progesterone and estrogen, and which protect the skin. They keep it resilient, and all the things we're going to talk about. But so that's the problem with birth control for women. It's we don't have any other solution. That's pretty sad.
It's an end all be all. They're like, oh, it fixes everything. If you're a woman, you just take it like a supplement every single day. It's like your vitamin D. But I think what's so important is, especially with the millennial generation and older, is we were never told the effects that the birth control pill can and will have on your body. I remember going in at the age of 14, didn't need it, decided, oh, my girlfriends are taking it, I should probably take it. And my doctor's like, yep, here's 6 boxes. See you later. I'll see you in 6 months. That was the end of the conversation.
We're not being fully informed. Even the risks are low, but they're still there, but they're not being informed. And we don't really, doctors will claim that it doesn't impact fertility later in life, but I don't think that this has been studied well enough for us to even make that claim. And women, I talk to them all the time. I was on birth control for 10 years and then I couldn't ever get pregnant. Or, now I'm suffering from endometriosis or PCOS or other or early post perimenopause. How do we know that the birth control pill doesn't cause this problem that we're seeing low levels of hormones earlier and earlier? Like women in their 20s have levels of like a 90-year-old now, because is this the impact that we're seeing now from decades use of birth control in the population? We're probably not liberating them, but in fact, we're probably making them more unhealthy. And if the birth control is meant for like a short-term use, yes, we should have control over these decisions, but it shouldn't be meant for a treatment. Like birth control is not a treatment for endometriosis. It's not a treatment for PCOS. It's not a treatment for acne. It's not a treatment. It's meant to be a birth control. It's supposed to make you infertile for a short period of time so you don't get pregnant.
Our clients they'll start birth control at a young age, and they'll say, oh, if people could see almost our files on the information we pull out, and it says, it didn't help my skin. I still have acne. And, of course, we don't say, of course, because we know that, right? Because that's a bit harsh. Rather, or people, what they do is they're like, I took birth control, or I'm on birth control, and it marginally made my skin better. And now I'm too scared to come off of it because they've contributed the pharmaceutical to the advancements of their skin, when adversely they have flares still, right? And they're not seeing that you're supposed to go through that, and your body's not supposed to be subject to blockers, and your body will fight for you. It's kind of like I'm saying. So your body's trying to say, I don't want this. I don't know what to do with it. I actually can't even use it. So
yeah, you're saying when they come off the birth control, they get like a flare. So then
they get a flare. Even when they're on, they'll still get cyclical flares, but they won't attribute it because their skin seems to be marginally better. And I would say the vast majority of our clients do not see the skin wins that they were promised when they were like, here, take this. This is going to improve it, because obviously you need to be on the birth control. That's what takes care of your skin.
I'm really glad to hear you say that. And that doesn't surprise me at all. Like you're literally taking away estrogen, progesterone. And we know how important this are for collagen, elastin, hyaluronic acid, sebum production, maintenance of like resilience, reducing inflammation in the skin. Like all of the skin is needed. Like you need estrogen and progesterone for it. So when you take it away, and when they go off of birth control, a lot of these women, they're not recovering their hormones. So we see that like it takes them a while, or they don't get their hormone levels back. And this is also what's devastating. So these probably see their skin because they don't have the estrogen, progesterone available.
And I'm so curious, Dr. Sarah, is obviously being a trained medical doctor, you went through that Western medical training and education and years in that system. For you, was there a turning point where you started to realize that these medications like the birth control were impacting the health of your patients, or was this something you kind of known the whole time?
No, it's interesting. Like there's zero training in medical school. And I know this is coming out now, that there are a lot more people talking about this. Zero like hours about women and their hormones in medical school. So we're like kind of told that, and I think that even most doctors think that birth control is hormones, and so women like associate this. And even when we see women who want to start, who need treatment in perimenopause and menopause, who are suffering greatly, they're afraid to go on hormone replacement therapy because they think it's going to be like birth control, because they've had this experience, and doctors still perpetuate this belief that hormones are the same thing as birth control. And it wasn't until later, I'm classically trained in pathology, which is the pathophysiology of disease, like all over the body. So I'm like a doctor's doctor, and did this for a long time. And you really see how we've failed, especially women, and like blocking, pharmaceuticals rely on blocking a process in the body, as opposed to providing the environment that is like enriching it so that the body can heal itself. Like you said, the body has the ability, it's fighting for itself. It has the ability to heal if you give it all the things that it needs to heal. And instead of in pharmacy, like, oh, your lipids are high, well, let's just block the production of LDL. Instead of looking at like the bigger picture, we're very symptomatic approach. And this doesn't work. Like it certainly doesn't work for preventative medicine or wellness. It might work for acute care. And we still need doctors that are specialists in acute care. If you get in a car accident, like we need that. Yeah. Like great.
I want to go to the ER. Please bring me to the ER.
Don't come to me.
And there's specialties in certain areas that are really important. But in terms of like prevention and wellness, we've really, like it's not trained. It's not a part of medical school. So anybody that does anti-aging or hormone therapy or nutrition or functional type of medicine has learned it outside of their traditional training.
And that's why I was so excited to have you on the show, is because you have that Western medical background and you've, been able to weave in that functional medicine component, the anti-aging, working with the body instead of against the body.
Exactly. And you really, the more you use that natural body process that's already existing, you just learn like what that, and the holistic approach, then the body will do it itself. And that's what's so incredible about it. And you see it over and over again, like women, they heal and you can almost age backwards. So that sounds weird, but your skin, you can totally prevent aging in the skin by doing the right.
You have just perked everybody's ears up listening. They're like, whoa, 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 Dr. Sarah, hold on. Let's go there for a quick minute. Is how are we going to start doing that? Because especially with so many of our listeners, the 30 plus range, the 30-year-olds, the 40-year-olds, even the 50-year-olds. So what are the things that we can be doing to start that process to be, really allowing our skin to reverse backwards?
So since I'm a hormone specialist, I really think we have been telling women that their hormones are, one, they have this really bad experience with birth control. And then we've also been telling them that estrogen is dangerous for them for decades now. And this is also harmful because women will actually think that they need to lower their estrogen. And when you look at prevention of wrinkles, skin integrity, wound healing, reducing inflammation, reducing pore size, getting like this dewy glow, you need estrogen. Estrogen increases the cell turnover. You need it to make collagen. So you can drink all the collagen you want. Like, I know that's like a big for your skin and hair, but you need estrogen to actually make that process happen of building and laying down collagen. We need it for hyaluronic acid. So estrogen is like really hydrating. So to get moisture into the skin and to keep it resilient, which we need that moisture, even just to maintain our body temperature. Our skin is like the largest organ in our body. It's like the barrier too. So it's not just like the look that we're going for. It's actually a reflection of our overall health. We should look at estrogen and progesterone as the cornerstone or foundation for anti-aging or prevention of wrinkles and decay in the skin. Like young women will do Botox, for example, and they do it young because they want to prevent the wrinkles. So I think women are thinking about it early. They're doing all the skincare, they're doing all the things that they want. But the most natural way, besides what you guys preach and like all the messaging, is hormones, to make sure that we're maintaining those levels and preserving them, not taking them away with birth control or even the, endocrine disruptors that are in all of the skincare creams now.
Oh my. This is a whole nother episode, is the endocrine disruptors in the skincare.
We're taking those away. And when you competitively bind to those receptors with those products, you're not allowing your own natural estrogen, which is what nature gave us to preserve our beauty. We're not allowing that to do its job. And so I think if women thought about that as the best anti-aging approach, we'd all have beautiful skin like as we aged. And we wouldn't need to like do all the extra things that we do for our skin if you think about all the stuff that women feel like they need to do.
Now, I am in obviously this health space with you both, the wellness space, and I love skincare. I love all things anti-aging, you name it. And I can honestly say it's not often that I hear somebody talk about the importance of estrogen and progesterone for anti-aging. Like very rare.
We talk about sun, for example, and UV damage, right? Like, so we spend all the time, like the sun is supposed to be here. It's like amazing. We should be in the sun. It's the sun does not cause skin cancer, for example. It's the things that we're doing underneath the sun, like all the chemicals that we're putting on our body that are causing that. And so it's not a natural substance that's causing the cancer, and estrogen is also not doing that. But when you even look at collagen breakdown, we stay out of the sun because we don't want the wrinkles because we're breaking down the collagen. Estrogen prevents that collagen breakdown, right? So and also estrogen causes the melanin to be evenly distributed within the skin. So women have this misconception that estrogen causes melasma. I don't know if you've heard that from your clients, but it's like, oh, I got melasma here and it's from the hormones. I was on birth control. I took birth control and I got melasma. And you're like, no, actually it was the fake estrogen. And then you took away your real estrogen. And then, because estrogen creates this like even skin tone, right? So even just that basic knowledge, if women knew how critical estrogen was for their skin and how beneficial, that would be incredible. And progesterone plays just as big of a role in terms of like hydration and boosting like elastin and getting this like kind of firm base that we're all looking for.
Every woman is, they all know about estrogen. I feel like that's like the number one, aside from testosterone, especially in the acne sufferers, they're like, it's my estrogen or my androgens. That's it. There's no other hormones at play for me here. So I'm so glad that you've been mentioning progesterone, because it really is such an unsung hero of the hormone orchestra.
Progesterone is our main hormone. So like, it's just the estrogen. We love the effects of estrogen, right? Like we love this like feminizing, effect because it's the main feminizing hormone. Progesterone is our main one though. And so when we really look at like if it's skin, for example, progesterone blocks DHT, which if you're, your listeners and very well that DHT causes increased sebum production and like pore size. And it's like the nasty stuff, like the greasy skin and hair and BO and like hair on the chin. This is all DHT doing that. Progesterone blocks that formation. So even if you're naturally prone to it, like when your estrogen drops or you're taking birth control, you've just blocked your natural pathway and that's why you get this like flare up and breakouts because your progesterone's like absent. And so even just the fact that we can block our own DHT production with progesterone is huge for skin. So if women were to think estrogen and progesterone are good and DHT, testosterone, as you mentioned, androgens are bad for the skin in terms of aging and acne too.
You're speaking our language. I know Chris is sitting over there being like, yes, 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 and yes, because we run for our clients. Chris oversees all client files and we're running Dutches. We're running alongside full blood panels. So we're seeing this all the time.
Yeah. And our philosophy is people come in and everything's hormone. And we're like, absolutely. We will give you hormones. How many hormones do you have? And they're like, well, I have estrogen or it's androgens like testosterone. I'm like, and right, they don't know the other ones. However, either way is the Dutch is they want to run that right away. And we're like, okay, can you hang out for a little bit? Can we clean up a few things? Because maybe you're detoxifying your own estrogen when you start taking out the static. And maybe when you don't have such estrogenic properties, your progesterone goes, hey, I'm here. Look at me. I can be seen again, right? So the body does have its own resiliency at some point. Of course, depending on the length of what someone's been going through, they might need some hormone assistance later on. Usually we kind of tackle it with the gut because if somebody does, just a lot of people, I think it's just marketing too. Like they want the Dutch right off. And I'm like, listen, I tell you your report, I'm going to see indican, I'm going to see your oats come off, I'm going to see your cortisol and your DHEA, and guess where I have to go first?
Them, especially with marketing, it's an overpriced test. You don't need it. Like it's really crazy. And it's actually not the gold standard. Urine has never been the gold standard for laboratory testing. It's always blood anyway. So it's just, I think there's a lot of misinformation there. And you're right. Like, let's take a step back. The laboratory testing is not like maybe the first step or the thing that we need to do. And there's some basics, like some low hanging fruit here that we can really address first that we know. And then we know you know the basics of what's causing it and how to treat it. And the laboratory testing often is not as insightful as I would like it to be, especially in older women. In progesterone, like as you mentioned, like I heard from an esthetician, I have a good esthetician friend, and she said she sees people and rosacea, like this is a really hard thing to treat, and but I'm like, rosacea is progesterone deficiency because progesterone is so anti-inflammatory in the skin and rosacea is like inflammation, right? So, eczema, things that are clearly inflammatory processes underneath the skin, that's like a sign of low progesterone. And instead of relying on these laboratory tests, because one, these laboratory tests have not been established the reference intervals. Like we have certainly not established reference interval for what the threshold is for great skin or not great skin. Even our estrogen level that we've established for women for appropriateness is only based on 49 women and 100 men. Our own hormone, we have used more men because we need a control, right? So we've used more controls than actual women. And if women understood how poor and how crappy the laboratory testing was really, wouldn't just run to it and like rely on it and try to like reflexively chase these laboratory tests, but instead rely on the principles that you preach, which are pretty we've known for a long time. If we block DHT and do all these things that will improve our skin, we don't need a test.
Yeah, it's interesting, right? Is so many women want to come in, they're like, oh, I immediately want to do a Dutch. We're like, okay, sure. Let's consider that later on. Let's first get these foundational steps in place. Let's get you sleeping, maybe. Let's get our body digesting, having bowel movements, stabilizing our blood sugar, looking on stress reduction. Let's work on these foundational principles first. And then when we've, worked on our gut and our liver, if we want to go and run a Dutch alongside your blood serum, amazing. But let's first get these foundational, easy, simple things in place.
I agree with you. I don't think that these, the metabolites, especially in those metabolite testing, it's even in my perimenopausal, menopausal clients, I will say, your test could become back normal all day long, but you're still having these problems, right? Like, can't you trust?
I think this is me.
I wish women would trust themselves more than lab tests. Like, they should know, I'm not sleeping, I'm not right, I don't feel like I should be, I don't feel like myself, my skin looks terrible, my hair looks terrible, despite me doing everything and, but doing all this stuff. They should trust that more than these lab tests. And lab tests are not perfect too. The labs, there's high biological variability, there's analytical variability, there's all these things that make them not perfect. They're good guidelines, they're good baselines. We can use them maybe to help guide, but they shouldn't be this only chasing a result, like that we're trying to get it in a result.
Yeah, because I think even when we're looking at those reference ranges on the blood serum, they're traditionally based on an unhealthy population as well. And those ranges are so vast and wide that oftentimes if they go to their doctor, they're like, oh, well, you're at the tail end of the range, but you're still within range, so everything's normal.
You bring a good point. Like those 49 women, we don't know if they were healthy. They were quote unquote healthy, but maybe they had they had underlying hormone deficiencies that we don't know that. We never established that. How do we establish that? So this is really you're comparing yourself to these 49 women in estrogen. And that's the case of estrogen. There are 0 studies. We have not established an optimal reference range for progesterone. There are only 5 papers in the entire world that have looked at this. This has not been addressed by the laboratory community, and it's embarrassing. They should be embarrassed by it.
Isn't that crazy?
Anybody out there in the lab community?
Just heads up.
As a side note, let's think about the 100 controlled studies for a second, right? I've research paper stuff. I just kind of like reading them. Even when I'm looking at controlled studies, right? It's one, who put it on? We always try and advocate for that, right? Who paid for it? Where's the sponsorships? Not just that, the 100 men, more and more men are becoming estrogenic because of everything even our clothing is plastic. Everything we do is plastic. And men, we're seeing higher levels of estrogen in men. So is this a true controlled study? Are they in a range of the androgen testosterone balancing where they need to be with, some progesterone, some estrogen, these types of things? I always like to look at that and just kind of delve into that, because I'm 49 women, we have more controls. What's the quality of the control, and what was happening with the women? And did we follow up? That's the kicker. Did we follow up?
No. They just established this is what we're calling normal. And another problem with this is that as you mentioned, who sponsors these studies, the only ones that can really afford it are pharmaceutical companies like Big Pharma. We've studied birth control. There are thousands of papers on birth control, which is not progestin, which is full of progestin, which is the fake progesterone. But we only have 5 studies on progesterone. This is just in terms of reference intervals and laboratory testing, obviously, but it still brings to your point that who's sponsoring this study and what are we really looking at? And we don't make a fake testosterone for men, put them on it as birth control, and then only study that fake testosterone. We don't do that to men, but we do that to women all day long. We give them a fake hormone and we put them on it, and then we only study that hormone instead of their real hormones. So yeah, I completely agree with you that this is why are we, again, let's go back to basics and foundational instead of these lab tests in a way, or that we need to do better. We have the ability, we need to do it.
Mm-hmm. Absolutely.
And I love that you said we're not putting men on fake testosterone and studying that. And I remember I think there was a few years ago where didn't they trial a male birth control, but their side effects were so severe that they discontinued the study. But in reality, the side effects weren't even close to what women experience.
No, you just take away their testosterone, and and you bring up this when the plastics are around. The plastics and the phthalates and the fragrances and potentially the birth control that's in the water because it doesn't break down like our natural hormones do, binding these receptors. And instead of using the word estrogen, just estrogenic, just because it makes it sound so negative, because estrogen's a good thing. We want, it's supposed to be there. It's not. But it is blocking LH and making men infertile, right? So it's basically shutting down this process in the body that then they can't make testosterone. So the same thing's happening to young women, right? So we're doing that. We're stopping their own production, even with all the environmental toxins you talk about. And then in all this, women are inundated with beauty care products, right? That have all this stuff in it. So, and then they become androgenic, which is a negative thing for their skin and everything too. So the only thing that's functioning are potentially their adrenal glands. And so they're able to make testosterone, and then they're making it in high amounts. And then they get polycystic ovarian syndrome, and then they get, they get all the stuff that's going on with their face and skin. And yeah, it's happening to both our men and our young population. It should be a crisis. Like we should be looking at this as like an absolute
100%.
crisis. Yeah.
Yeah, we should absolutely be looking at this because like we are the most advanced as a human civilization as we have ever been. Like, let's think about AI and all of this tech that we have. And yet we're probably one of the unhealthiest we've ever been here in North America.
That's accurate. Actually, teenage, just as a sidebar here, the teenage population is the most unhealthy population we have seen ever. And there's statistics time after time and time. And again, it goes back to say to that pharmaceutical or where the money talks, because you're not going to cut off your avenues of money. Like money really talks in everything. I mean, I know I like to get a paycheck, so I'm going to stand in line. However, when it comes to your health, I really need people to understand the difference between money and health. They shouldn't really go to kind of together unless you're investing in your health so that you don't have to go down this way. And that's called prevention.
I agree with you. People think that wellness is expensive. They should try illness. Like, I mean, this is really like, it should be the most important thing. And there are other societies like that value it more than we. And we are, like you said, first world, we should be valuing this. And I do think it's a crisis in our youth that we're seeing this unhealthiness. And I do think it's hormonal and it's environmental and it's diet or like what we're doing to these young people. And in women, like in their 20s, if they're really looking at this prevention, which I do think women are more aware now of, if they knew like that this androgen, actually testosterone and DHT, broke down collagen, that it aged the skin, that it causes inflammation in the skin, and understood that they needed their natural hormones to be at a level and what impacted that. And then if they don't do it, they're going to start turning into men, just like men are starting to turn into women. Just like you mentioned, these teenage boys are becoming estrogenic. They're like starting to look like more like women. Our young women are starting to look more like men. They're getting hair on their face. They're getting acne. They're losing hair on their scalp. They're gaining weight. They're getting bloated. And it's because of this impact, right? So it's all body wide. It's not just your skin. But if these basic foundational, like you said, estrogen and progesterone, good. DHT, testosterone, bad.
Especially for mood. And I don't think a lot of people know how much progesterone really works on those GABA, neurotransmitters. And I don't know about you, but I prefer to be in a good mood. Right? Like I'll take me some progesterone. Right?
Progesterone is our nature's way of keeping us tolerant around men and small children. Like there's no way that women would be able to have like baby after baby and like not drown subsequent babies. Like it's really like we maintain our very calm demeanor. We are very receptive. And this calm centeredness is all progesterone, and it needs to be high. Like when you look at relative concentrations, if you put everything in the same units so that we can kind of talk in the same, like progesterone is magnitudes higher for women than testosterone is for men, and it gets even higher during pregnancy. So I think that we cannot ignore the impact that this hormone has on our immune system, on our well-being, our mental health, our sleep, our metabolism, weight maintenance, like muscle build, literally everything in the body.
I think every woman listening was like, we all need the progesterone so I can tolerate my husband and children. That's what it's missing. That's all I need.
That's all I need. Yeah. Well, I have clients that come in and they're like, I all of a sudden hate my husband. He's a great guy. I don't know what's wrong. And it's not just about sex drive. It's like, I literally can't even stand to hear him breathe. Like this is the thing. And it's disrupting their marriage. They don't want it. And then a few weeks later after hormone replacement therapy on the progesterone, especially, they're like, I think I love my husband again. And it is because saving
marriages
all day long in our balance.
All day. And it's the thing is, it's not you, it's your hormones. And I think when you understand that, you realize, do you ever hear this, Dr. Sarah, where women are like, I think I'm crazy. Like, I think I'm crazy. I've been told there's nothing wrong with me. My labs are normal. Then but why do I hate my husband? Why am I snapping at my children? How come my hair is falling out? How come I have mood swings? How come I'm like panicking every day?
We're gaslighting women. I mean, I think this is obvious. It's like, and it's so, it's so easy as doctors do it, unfortunately, more than they should. And it's like, and it's because they don't know about hormones. So they're afraid of what they don't know. They're not trained in it. So they just gaslight them. And this is the problem is you're too tired because you're not taking care of yourself. You're not eating right. You have too many kids, whatever. I mean, you're busy. Like and then women tend to do it to themselves. Man, are my friends having this problem? Or do I not have it together enough? Because women put these expectations on themselves and society does it. we're highly, capable, and we take on more than we need to. And then we just blame ourselves. And this is another form of just telling women that the problem is them instead of us. Like, medicine's the problem. We're the problem. Like, we need to have a solution for you and understand this and research it and like support you, as opposed to just blaming. You're not exercising enough. You're not eating enough. You're crazy. This is in your head. This is part of being a woman. That's all just more blaming. We've done it through all history. Like, if you just look at like what we've done to women, we're just continuing to do it. And then telling women that estrogen's bad for them, their own estrogen, not like these xenoestrogens that are in the environment, but their own estrogen. This is another form of telling women that there's something wrong with them. Even their femininity is like wrong. This is sexist misogyny and sex. I mean, you can go into like maybe why we're doing that, but
it's a whole rabbit hole.
We need to stop. Like, we need to like
we need to stop. It's so interesting, right? We're in 2025 and this is still an issue of gaslighting women, of not giving them the tools and the education. And it's like, at what point in the thousands of years we have been alive are women finally going to be able to be seen and heard and understood?
I think we're at least starting to talk about it. Like, when you look at the gender data gap that's happened in medicine, most of the studies, I think this, are like done on men. Like, even for the pharmaceutical companies, like they didn't want to include women because of their cycles and they messed stuff up. But also, even if you just look at basic stuff, like the cars are designed for men, the iPhones, like the size of the iPhone, are designed for men's hands. They're not designed for women. We're like literally half the population, and we're not included in any of these, like even technology designs. And so when we look at hormone replacement therapy, it's even more of before I started our Balance Online and just treated women, I did clinic and I did men's treatment as well. And when you see, if women knew the way that we treat men so differently for hormone replacement therapy, they would be appalled. Like, women would not, like, they should be mad about it, because like what we do for men is, hey, you have erection issues, or you have low sex drive, or something's going on. Well, testosterone, there's a really low threshold for giving you the right hormone in the right amount so that they feel really great, right? We know that testosterone's great. We don't tell them that testosterone's bad. We don't tell them that their testosterone's too high, right? But then a woman comes in and we're like, your estrogen's the problem. You have too much estrogen. And, instead of just looking at the whole picture of like, you actually need progesterone and all these other things that are going on with you, but we don't, or maybe she's just a problem. This is just a part of being a woman. And then if we do wait until her period stops, we make her wait until she's like 55. We make her like, oh, you have to wait until, because you're still making hormones if you have your period. That's what we're telling women, which is garbage. And then we make her wait way too long. She suffers for 20 years. And then we finally give her some of her hormone and we microdose it just a little bit, like just enough so you don't have a hot flash. Certainly not enough to make your skin look great or your hair look great or to prevent diabetes or all the things that we know that hormones do, like preventing Alzheimer's and dementia and heart disease.
Just a few things, just a couple
minor things, right?
Little minor items.
But we do that we have a completely different approach and outlook of how we view testosterone's good for men, but hormones are bad for women, right? So we need to understand that stark contrast is sexist, and we're doing to men.
Yeah, I'm gonna have to go and meditate after this because I'm getting so riled up talking about it. I'm like,
I'm like, why? And I love that you're just saying this message.
It's infuriating. Like, women, they continue to be, put below her, like for whatever reason, this population, especially 30 and above, is completely ignored in medicine. Like, we have OB-GYNs that are trained for fertility and baby, making, or like, I guess, like getting pregnant and like having babies. So, we have a lot of help for that population. But once you're postpartum, like there's no help. And then also like after that, and it's just sexism. I really think we need to treat, even just this, if society were to look at estrogen and progesterone the same way for women as we view testosterone for men, this is a really good.
So two things I want to dig into is I want to dig into those, the foundation, the nutrition, the lifestyle habits that we can be looking at. But I also want to talk a little bit more about hormone replacement therapy, because I think HRT is something a lot of women just don't understand. Like, you hear it, you know about it, but you really don't get it. So I think, Dr. Sarah, could you kind of break down, like, what is hormone replacement therapy? Who's a good candidate? And how does it work?
Yeah, so hormone replacement therapy is different. We kind of mentioned the birth control in that we're enriching your levels. So you can do, a lot of people will do a lot of things. They'll eliminate all the stuff from their environment. They're doing all your recommendations that you guys recommend, and then they're still struggling. And, one way to prevent this estrogen dominance, or to prevent these nasty chemicals and all these problems from binding to these receptors, for example, is to make sure that your levels are high enough. And sometimes it doesn't work. And anybody that can't get it to work would be a candidate. And this is anybody over the age of 21, really. So, and we have a lot of people having different types of symptoms. So women especially will see anxiety and depression and insomnia. These are like some of these first ones. And then we see, because progesterone drops off, and progesterone is really critical for those. And then they'll start to see a decline in their energy levels and their ability to gain muscle, their fatigue, fatigue just gets worse, their hair and the skin, outlook. And it was really mental. A lot of it's mental for women. But what we're also seeing, so that's just this really large group of what we're calling perimenopause. And so women, when we're talking about hormone replacement therapy, we're just simply replacing the hormone that you can no longer make. And we think that, yes, it's environmental, but it's also aging. I don't think women were ever meant to have babies in their 30s. Our ancestors died when they were 35, probably. Like, we weren't meant to live till 90. And so the ovaries simply were not meant to work. They're not functioning at age 40 like we are telling women that they are functioning. They're just having a period because there's like a shedding that's going on, but they're not making hormones. And so when we replace them, it's more natural theoretically than supplements, right? Because we don't have a black cohosh deficiency. Like, we don't normally make black cohosh or primrose oil or whatever else we're trying. We don't even know how those supplements really work, So the hormones are just the chemical exactly. They bind to the receptor just like you would naturally make that. And that's why we try to get this most natural result, is just by using the hormones that you normally used to make. And sometimes women don't ever make them. They say, wow, I haven't felt this good ever. Like, I felt like I was low in my 20s too, or after birth control, or I've never felt this good. So not realizing how critical it was for their mood. Another candidate would be, so this is perimenopause and menopause group, which is anybody over the age of 30 really is going through perimenopause. The only difference between perimenopause and menopause is that the period stops in menopause. And women should never wait for the period to stop. This is like the absolute last thing to happen. It's too late. Like, it's almost too late. Like, they really should have started 15 years before that. So I want women to know that they shouldn't, if they're being told that, that's incorrect. They should not wait for that. And then, but we're seeing this younger population too that could be potentially candidates for hormone replacement therapy. And that might be PCOS or endometriosis. If they can't, like, you're telling a PCOS patient to lose weight and you're trying all the things, right? Like, sometimes you do need progesterone to lower that LH, right? Progesterone lowers LH in the brain. And the reason why they can't quite get that cycle to stop is because they can't make the progesterone. So if you help them with the progesterone, they can lower the LH, and then the diet will work. All of the things that they're being told about insulin resistance would finally fall into place for them. And another group that it might work for, and we're having great success with, is endometriosis. So endometriosis is also a progesterone deficiency. So progesterone stops the proliferation of the uterine lining. So this is where they're getting this like extremely painful condition. I don't know if you have any endometriosis patients.
Oh, we got a few. Endo, PCOS, we got them all.
So this, we see endometriosis pain go away in 3 months on progesterone, right? So this, and then it doesn't mean, and hormone replacement therapy doesn't mean it's the only thing you need to do. It doesn't mean that you don't have to do the diet and all of the other stuff that you are preaching, and like this foundational stuff is still foundational, right? So, and you still want to make sure, in order to have them balanced, that you're avoiding all of the chemicals still, right? So you're not competing for that receptor. You're allowing the estrogen and progesterone bind the way it needs to. Hormone replacement therapy is part of that foundational work, right? We need to have that in place, and then we still need to do all the other things. So it doesn't mean that that PCOS patient isn't going to still have to do the other measures that we need her to. It's just that we're going to help lower that LH so that the testosterone will stop being produced.
I think that's the important thing that you noted, is it's not just about the one thing where I just need the hormone replacement therapy and I change nothing about my life. It's like the hormone replacement therapy is an incredible tool in your toolbox, alongside sleeping, alongside stress reduction, alongside eating enough calories in a day, alongside setting boundaries. It's really about this all-encompassing, holistic approach to your hormones.
Yes, you have to do it all. Sometimes women need the hormones first, and then they're able to sleep, and then they're able to like do all the things you ask them because they were so tired in the first place. Sometimes they can't even go to the gym or walk to the mailbox or, so you kind of give them, do better when they feel better. You kind of give them that foundation first, and then they're able to do and continue to get better. But you're right. It's just part of this overall approach to the treatment is the hormone replacement therapy. And so if women looked at that, it's more of like supplement than it is anything else, right? I think probably the best supplement you can take.
I'm so glad you came on to talk about hormone replacement therapy because it's something we haven't talked about before. And like I said, it's such a I feel like it's such a misunderstood topic for so many where they're like almost a little scared. They're like, oh, I don't know if I want to start taking that. I don't want to start messing with things. But, when we're looking at the HRT, is there different ways? I know that you can be doing it topically, whether it's on your skin, you can be doing it vaginally. So what are those different ways that they can be utilizing the HRT?
Yeah. And I think that's that concern of I'm going to mess things up is really common, but you're already messed up. Like you're already low, right? Like you were extremely low. You're not making anything like this. Let's just like give you the support that you need. So like, you should feel great your whole life. Why not do it? Like you shouldn't suffer. And like, we are not messing stuff up because you were not suppressing LH in the brain with hormone replacement therapy. None of the options out there are doing that. You have to get really high levels of hormones to suppress that. And that means that women can still get pregnant, for example. I think there's this misconception that if I start hormone replacement therapy, that I'm going to make myself infertile or that I'm not going to, that I've somehow stopping this ovulation or this part of the brain that's like making me cycle. And they don't want to stop cycling because they're only 38 or they're 35 or, they're young, even younger. 25-year-olds certainly haven't even had kids yet. Right. So I think if women understood that we're not stopping that ovulation, we're not interrupting it. We're just supporting, we're just supplementing, we're enriching that so that all these bad chemicals will stop binding to your estrogen receptor for starters. And then you can sleep, Like you can do all these other things too. And heal so that would help with women understand we're not like, you can even start it and stop it. You can start it and get pregnant and start it again after pregnancy. This can be like as more of a supplement than anything. And there are better ways to take it. There is actually so when you talk about hormones, when you swallow them, they have a very low bioavailability. And you guys know about liver totally breaks everything up. 80% of it's gone. And talk about more of sexism in medicine. We give women oral progesterone all the time because it's a great sleeping pill. It's actually just more of a cop out. Here, just take oral progesterone and make you fall asleep. When it's actually not replacing her progesterone levels to what they need to be. We're just simply giving her another symptom management. It's like a pill. And so that's always bothered me about that. And I've taken it myself, and it really makes you fall asleep really fast. So, but it is not the most effective because it ends up making a lot of side effects, bloating, irritability, weight gain, and grogginess. And women don't really feel like themselves. They feel kind of sleepy the next day. And you don't want to walk around sleepy. We're not trying to suppress women or subdue them. We have to make them feel better. And so bioavailability in hormones is huge, right? And if you try to put it through the skin, it's the same thing. Progesterone only has a 20% bioavailability. So some women feel better when they put progesterone on the skin. There's yam creams on the market. There's a lot of stuff that you can put through the skin and they feel better initially. They actually feel like they might be more calm or they can sleep or they feel a little bit better. Can you imagine how they would feel if they had something that had 80 or 90 or 100% bioavailability? Even better. So these women are getting some relief with oral progesterone. They're getting some relief with topicals. Can you imagine a product? Well, and there is a product, right? So that's what we sell. We sell one, and it's vaginal. And so women, if they knew how powerful drug delivery and hormone delivery through vaginal wall is, they would be excited. This is really a benefit that we have over men. Maybe one of the but men have to inject testosterone to get their bioavailability up, right? They inject it twice a week or sometimes once a week. Women, vaginal, the mucosa is so you can diffuse right through it, goes right into the bloodstream, and it's close to an injection bioavailability. It goes right, and you avoid liver metabolism, and you get all the metabolites that you need to go to the brain. Virtually everybody notices their mood and sleep and outlook improve within 10 days. That's how fast it works. For postpartum depression, you name it. Depression is huge for women, and we're just handing out antidepressants like crazy. This is some kind of it's normal. It's wild to me. And Xanax and anti-anxiety, and women really just need their own natural progesterone. And when you take it vaginally and you insert it vaginally, it diffuses and they feel amazing really fast, and it's natural. And this is like what we should be looking at for women. And it's a vaginal delivery.
I know it's so incredible that we don't realize how absorbable the vaginal walls are. I know that's a whole nother topic of like the tampons and the things that are going in there, but it's such an absorbable area. And the fact that you can be utilizing this for HRT and getting such a high absorption rate and feeling better so quickly is such an incredible thing.
You're right. And I didn't even think about that tampon thing. And you're absolutely right. Like we were putting, yeah. So this cream, we make it with a small amount of cream as possible, talking about that. And then it also, the cream is discharged, right? So we don't want to absorb the cream. It's just to hold the hormones. So we absorb the hormones and then we discharge the cream to try to reduce anything that's being absorbed that way. So that helps. And then also the contamination risk is a lot lower. So like women are putting creams on their skin, right? This is a really common, they'll get HRT and they'll put estrogen and progesterone and testosterone on their skin. And it gets all over. I don't care what any company is saying that it doesn't get on anything and that it's absorbed. It is not. I've worked with clients, they get it on their kids, they get it on their pets, they get it on their husband, they get it in the sheets and the bed sheets. It's all over the house. It's like if with only 20% bioavailability, the rest of it's everywhere. And so women are told that this is not a risk, but it absolutely is. And so when you put it vaginally, it's contained. Right? It's contained. And then you get most of it to absorb. The rest of it can leak out on like a liner. And as long as you wait a few hours in between sexual contact, you're not going to contaminate your partner. And so this is a much better way and safer way for us to deliver it without having to do an injection. The next best thing would be an injection for women, which so I think that in terms of like just being a stewardship and being aware of that have people around us with these hormones too. So vaginal, I have a lot of young clients that have young children, right? These are young moms and
picking their kids up. And if you're putting on your forearm, like it's going right on your kid.
Even when we would put it between the legs, like, and they try to you're still got laundry issues, like you've still got it on the skin and it's not being absorbed all the way. So the vaginal is like really, women can be like at ease that they're not getting it on their children. And I talk to veterinarians too, and it gets all over the pets, and they bring their pets in and the vulva gets like huge and they're like on their dog.
Just, no way.
Oh my gosh.
Yeah. I never even thought about that.
Yeah. You wouldn't think about it, but it's like, so we need to think about this contamination issue. And we don't, I would never give men a testosterone cream because that would get all over the house. So why are we giving women hormone creams that are on their
100%?
And it's very, very prescribed too, right? Like, and in Canada, you don't see acupuncturists with script writing and stuff, but in the States, holy banana, so many people have script privileges, and it kind of throws me for a loop. So we had one client on hormone replacement, oral. Obviously, the dose keeps getting adjusted, not in consideration that the liver has to metabolize it and we have to do something with it. So what happens? Not enough, more and more. Her hair starts falling out. Her skin starts going extremely rough. So everything that progesterone helps to culture and estrogen naturally culture, it was going opposite. She ended up going to a different doctor and said, you need to be off this. This is outrageous, the amounts that you're on. And, it doesn't matter gender of the doctors, but I truly do believe that when you are going specific for female hormones, I personally like to go to a female. So when I say, listen, I'm a bit ragey, you understand truly what it means to be a bit ragey. I'll have to explain, right? Because sometimes I find even male practitioners, they understand the reciprocation of that. They understand how their partner is ragey, right? So it's a different lens. But that's just me. However, you know what? I just wanted to tell people that please remember, when you're taking anything orally, we do rely on the liver heavily in the process for bioavailability.
When you take oral progesterone and at those amounts that you're talking about, those metabolites, like 80% of them, those metabolites, not only do they make you sleepy, but they turn into testosterone. And so this testosterone she was converting, and that's why she was losing her hair and her skin was getting rough, and she was noticing like a sweaty, like she just got like too, like that. You were basically making her imbalanced with that oral. And it's because you cannot control what the liver does and those metabolites and what they turn into. So metabolism is like so important. And when we deliver it vaginally, there's just like liver first pass metabolism. There's something called uterine first pass metabolism where the uterus can metabolize it. And then it's these kind of, we're trying to mimic the natural state, maybe. Like, let's say the ovary makes the hormone, estrogen, progesterone, and then that is metabolized by uterus, right? It's right there. And so then the uterus makes these metabolites to go to the brain and prevent depression and anxiety and all these things. And so this trying to mimic not only the bioidentical hormone that we used to make, but also the natural metabolism process that our body potentially does is also important, so that you get the best result, like you're talking about. You don't get your hair falling out and get acne and these side effects. If somebody gets side effects from hormone replacement therapy, they're just doing it wrong.
And I don't know any lady that's going to be like, hey, I'll just take some hair loss. No, we don't sign up for that stuff, ladies. We don't sign up,
It's really hard to get back. Yeah, it's
really hard. So Dr. Sarah, this has been probably one of my favorite chats we've had in a while. It's been so informative, and I think it's been so helpful for so many women listening, especially coming from a medical doctor as well. So, I think you've really piqued the interest of a lot of our listeners is if they want to learn more about the vaginal hormone replacement therapy. I know this is something that you offer at Inner Balance. So where can they go to learn more about this? Where can they go?
Thank you. So we're online. We're all 100% online, trying to make it as easy as possible. And we're in 40 states now. So you can sign up online. We have a medical questionnaire that you have to fill out, and then you meet with myself or another expert like right away. And it's at www.innerbalance.com. So you can just search for that. And
it's in the show notes. I put it all in the show notes.
Amazing.
Yeah. And what's the name of the HRT?
It's called Oestra, and it's customizable. So really, I'll put everybody on a starting dose, right? You got to start somewhere, and then we customize it from there. So we really want to see, again, like following these foundational principles, how is your body using the hormones? We watch and wait. We really need to see, and that's how you can take an individualized approach. So we may recommend supplements or other things, that are, how do you try to balance and see how the body's metabolizing and converting, as opposed to a laboratory test. And this is really, you get the best effect that way, and women get the most individualized care this way too. And so that is like a 6-month process. I would say, like to kind of warn women that it's a 6-month journey. Like you're not going to start HRT, and there may be, there's a percentage of women that fly right through and they do great. And then there's another percentage that really do need to adjust and maybe make some other changes. As we mentioned, it's kind of like part of the tool, but there's other things. So that it's just a journey, and where we support the whole process though. So, and we do it online. So it's great. Easy.
Amazing. So I put all of the information in the show notes. I highly recommend going and checking out her website, Dr. Sarah's website. Instagram is phenomenal. This, I think, could be such a game changer for so many women. So if you've been struggling, like I said, go and check her out. This has been a phenomenal episode, and I do recommend listening to it again. So thank you so much for coming in today, Dr. Sarah.
Thank you both. I really appreciate it. Yeah.
Awesome. All right, everybody. That was another episode of the Clear Skin Chronicles. We will see you again next week. Have a good week.